patient information screen has detailed information for each patient. Each time a new account is entered and saved, this screen is automatically presented. The patient number appears in the upper left corner. Just as the account number always ends in 00, the first patient number always ends in 01. This number will be incremented by 1 for each additional patient added to this account. Each patient is added to this account from the main screen, which will be covered later. The first relation field we see on this screen refers to the relationship of this patient to the head of the account. When the first patient is entered, it is assumed that self is the relationship. This can be changed if necessary. This field presents another drop-down list. If this patient has insurance coverage, another relationship field will be entered later. The first patient entered for this account will have the first name automatically entered from the new account information screen. Each subsequent patient added to this account will be assumed to have the same last name, but the first name may be entered. The nickname or preferred name can be filled in the nickname field. The sex box should be checked for male or female. The birth date can be entered next. All of the address and telephone information will be automatically entered from the account information record. This information may be changed. For example, if the patient is a student and away from home, he may have a different address than his parents. The inactive box can be checked if this patient is not an active patient. For example, if this patient moves away, we may want to inactivate them. If there's any chance they may return, we do not want to delete them. If there is no chance they will return, we can press the delete button below. If the medical alert box is checked, a medical alert button will appear on the main screen and checkout. Also, this will be indicated on any recall list. The family or friend box is simply there to indicate to others in the practice that this patient is family or friend of someone in the practice. The ortho patient box should be checked if this patient is undergoing orthodontic treatment. A payment plan can be created for any given patient. This topic will be covered in another section. The flag field is a free-form field. It can be used solely for the purposes of this practice. It is especially helpful for creating reports with the report writer. For example, one practice with a female dentist treated many patients that were sensitive to some materials. For those patients, they placed an MA for materials alert in the flag field. They had some patients who came to the practice because they specifically wanted a female dentist. For those patients, they placed an F in the flag field. Some patients received an MA and an F. This enabled the practice to create reports showing lists of both types of patients. When the student field is selected, a small window will open allowing for selection of full-time, part-time, or not a student. This may be necessary if the patient has insurance. If this patient is indicated as a child relationship to the insurance policyholder and is over 18 years of age, the student status must be selected. When the employment status field is selected, a window will open allowing you to select employed full-time, employed part-time, retired, or not employed. The fee field allows you to select the fee schedule for this patient. The procedure database has allocation for 6 different fees for each procedure. 1 through 6 should be selected for the fee field. The default is 1. When the marital status field is selected, another window will open allowing for selection of the marital status. This is generally only important if the patient has insurance. The Social Security number is a required field if the patient has insurance. 9 digits can be entered without any dashes. These will be entered automatically. The best time to call and best appointment time can be entered next. The email address for this patient may also be entered. When the missing teeth field is selected, a tooth chart will open, allowing for the selection of missing teeth. This should be filled in after the examination. This information may be required by the insurance company. It will also be useful if the period charting program is used. The date added, modified, last treatment, and last hygiene will all be maintained automatically by the system. The ReCare box should be checked if this patient will be called for future hygiene visits. Most insurance companies will pay for 2 cleanings per year. Some insurance companies require that these cleanings be spaced a minimum of 6 months apart. If this patient's insurance company has that requirement, be sure to check the 6-month limit box. When this patient appears on a recall report, they will not be due in less than 6 months. If the 6-month limit box is not checked and a patient is on a 6-month recall, they will be specified to appear after the first day of the 6th month. This gives the practice greater flexibility when scheduling these patients and maintains the 6-month limit only when required. When patients have a cycle other than 6 months, the cycle field should be changed. If this patient has insurance, we must complete the insurance box in the lower right corner accurately. The I-code field refers to a code that we can assign to a specific insurance plan. If this insurance plan has already been entered into the system, we can enter the code into the field if we know that code. If we do not know the code, we can press the primary button. It will always ask if the current patient is the policyholder of this insurance policy. If we answer yes, the current patient number will be inserted for the subscriber number and a relationship will be entered as self. If we answer no, we are given a list of all patients. We can select the patient that is the policyholder for the plan for this patient. The policyholder is not required to be in the same account as the patient. They can be any patient in the computer. They may not be an actual patient. If that is the case, they should be entered as a patient and checked as inactive. Policyholders should always be entered before dependent patients. If the patient is the policyholder, we will be asked if the plan is currently in the database. Normally, we will answer no to this question. This will take us to the insurance detail screen where we can enter a new plan in the database. If we are sure we have entered this specific plan with the identical group number, we can answer yes to the previous question. This will take us to the insurance list screen. We can select the plan from the list and double-click it. This will insert the appropriate I-code on the patient information screen. The signature on file buttons indicate where the signature on file will be shown on the insurance claim. The signature on file left indicates the patient agrees to allow the information to be sent. The signature on file right, if checked, will indicate that the insurance company should pay the dentist and not the patient. If payment should be made to the patient, signature on file right should be unchecked. If the patient has met their deductible, for example, at another practice, the deductible met box should be checked. Likewise, if this patient has met their maximum insurance, that box should also be checked. These boxes, as well as the remaining deductible and remaining insurance, will be automatically updated by the system. When we have completed all the information on this screen, we can press the Save button. This completes the entry of the information for the new patient for a new account. To enter a new patient into an existing account, we simply select any patient that belongs to that account on the Find Patient screen. We then select the main screen from the main tab at the top of any screen. On the main screen, we press the New Patient button. It should only be pressed when a new patient is to be added to that account.